So something else I recommend, before you go to an appointment, before every appointment, thoroughly review your lab reports if you can understand them, plus your list of questions, as I mentioned before, and just any notes that you took following the last appointment, or questions you've developed since the last appointment. Thoroughly review these before every appointment, and make a separate list that pertains to that specialist. So for example, if I'm on my way in to see my hematologist, I'm not going to bring my list with me about joint pain. Or if I'm on my way in to see my gastroenterologist, I'm not going to tell my gastroenterologist about my complaints about headache or backache. I make separate lists for each that I have for each of my specialists. And I'm showing here on the slides electronic devices because that's what I use. But paper isn't obsolete yet. It may be someday, but not yet. You may have questions about a potential treatment that you may have read about. Be sure to ask. You should also go into every appointment with a list of all your prescriptions. Now, if your primary care doctor probably has the list. But if you're seeing a specialist your primary care doctor doesn't know about, who prescribed something for you, you should make sure your primary care doctor knows not only about every prescription drug you're taking, but your primary care doctor and every specialist you see should also know about vitamins and herbs that you're taking. A lot of people don't know this, but herbs in particular can have profound effects. They can alter the effects of other drugs you're on. Now, this may not be applicable for some of you, but I read medical newsletters and I read about new treatments, and sometimes I want my doctor to consider this treatment. So what I do is I come in and I hand the doctor a printed copy of the study that I read, that I found on this. If I just say, I read about something on the internet, they're not going to want to hear about it. But if I say, I read about it from Cochrane database, and here's the study, and you can read it at your leisure, then the doctor's more likely to pay attention to that.